In this video, we'll cover the 5 top reasons for extracting teeth. Hi, I'm Dr. Lee Sheldon. Welcome to Practical Treatment Planning. Reason number 1, your budget. You don't have enough money to do all the work that you need to do. And the difficulty we have is we sometimes see the dentist, we have a toothache, and the dentist says, get a root canal done, and we ignore all the other teeth that are involved. We need to assess all the teeth first. So if you see decay in different parts of the mouth, we've got to prioritize your budget. We can't just spend a lot of money on one tooth. Here's an example. Person saw a dentist. Dentist said, go get the root canal. She got the root canal. She then couldn't afford the crown on the root canal treated tooth. Meantime, she had all of this other decay, and now it's 8 years later. Now she can't save these 3 teeth either. See, we got to take a look at these things on a priority basis. We don't have unlimited money, do we? And so we have to look at each individual tooth, and then we have to look at the entire mouth and be able to help you predict which teeth can be saved, which teeth should be saved, and which teeth should not. Number 2, you've exhausted all the possibilities in saving a tooth. So we do things with good intentions. When we're trying to save teeth, we're trying to save teeth. But, sometimes it doesn't always work. We've got to look at when it's time to hold them and when it's time to fold them. And when it's time to fold them, then we fold them, and we fold them with good reason and good intention. Not everything works. But as you've gotten from this particular video, there are a number of different things we can do to predict in advance whether it's going to be worthwhile to spend the money on the tooth or whether it's not. Number 3, we need to save critical teeth for tooth replacement. Okay, so now this assumes that you're extracting teeth or you've already extracted teeth. And we've got to put in prosthetics or tooth replacements. When we're doing that, we're thinking an entire different way. What teeth are going to be around for a long period of time because we don't want to have to redo and redo and redo dentistry. And so what we're looking at is the critical supports. We want to save the best teeth for critical supports for the prosthetic work. Therefore, whether we do fixed bridge work, whether we do implants, whether we do partial dentures, we don't want to have to worry about losing teeth later on. So at that point, we're looking at what are the best supports, what's the firmest foundation that we can provide, and then we may extract other teeth around that in order to be able to make sure that your prosthetic treatment lasts for as long as it possibly can. Number 4, you refuse to stop sugar. It means all the candy, the cakes, all the processed foods, everything, add those up. And if you're eating a lot of sugar and your teeth are decaying, is it a good idea to invest in teeth? No. The best thing you can do for your teeth, and frankly for your overall health, is stop the sugar. Stop the sugar. It's not doing you a bit of good. It's hurting you and it's hurting your teeth. Dental care costs a lot. We don't want to spend money on crowns and then see the crowns rot from underneath, because they will rot. A crown will not stop a new cavity from forming. A new cavity will just form right under that crown. So if you're going to alter your schedule, I'm going to alter my treatment plan. If you're going to say, I'm going to stop sugar, I may be more inclined to save the tooth. If you say, I'm not going to stop sugar, then I'm going to say, well, why don't we extract the tooth? Number 5, you have an infection and you can't afford to treat the infection. The least expensive treatment is extraction of a tooth. And what's most important in the mouth is infections. So when we're looking in your mouth, we're looking at infections first. We need to solve all the infections before we build on the foundation that we've created. Let's assume you have massive periodontal disease. We can get that under control. We can solve that problem. If we can solve that problem, then we can build to the next phase. Number 5, you have an abscess and you can't afford to treat it. That's okay. Let's make that decision early. Extractions are the least expensive part of dentistry. We should be able to budget. We should be able to tell you what you're going to need this year, next year, and the year after in our treatment plan. And that way we can budget appropriately. Would I rather save teeth? That's what I do for a living. But we've got to talk about the practical value. There are budgets involved. And if you can't afford to take care of a tooth and you have an infection, the least expensive way of solving that infection problem is extraction. You know what? I just said budget twice. Notice number 1 and number 5 ended up being budget. That's how important practical treatment planning is. That's this site. That's why I'm doing this site. do treatment plans, full mouth treatment plans, whether you're a doctor or whether you're a patient. Make sure you understand what the full ramifications are of every decision you make, which means full mouth treatment planning every time you see a patient, and patients insist upon that from your doctor. If you do, then the decisions you'll be making will be made on a whole mouth basis rather than tooth by tooth. Okay? We'll see you again next time.